Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Cernăianu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. This podcast episode is going to be all about what an anti-aging wellness exam should include and what is most valuable to focus on during a wellness check from an anti-aging standpoint. Obviously, the target for such an exam is mainly for people who are in their 50s and beyond, because this is the decade when most people start to get concerned with anti-aging. By now, they realize their body's changing, not in a good way. Their mood is changing, not in a good way. The mental activity is declining. There's another face looking back at you from the mirror. Most people are concerned enough to start looking into anti-aging and realize it can be slowed down and we can age better. Most people concerned with the prevention of aging at this point say, okay, it's time for me to get some help. Unfortunately, most resort to the World Wide Web for this, but the real help will not come from the internet. It will come from a trained physician, a trained provider who can guide you in your specific direction that you need to go to manage the ravages of time. The ravages of time is not just, I look in the mirror, I see all these wrinkles, the excess fat, and the soft, saggy spots on the body, but you might remember how you were feeling a decade or two ago and just realize you simply do not feel the same. There's an underlying stiffness, a gradual weakening, a decrease in stamina and recovery post-exercise, a mood change, maybe you're more grumpy, more irritable, maybe you're more forgetful, maybe you need to make lists now. There's small changes, maybe subtle, but they're very telling. And many of these are simply nuances of the aging process that most people overlook, or sometimes they're simply in denial about. However, whether you believe or not in anti-aging, you should believe that your wellness check when you turn 50 and beyond should be more than a simple 10 to 15 minute assessment. If that is all the time that you spend with a doctor, and if some basic blood test that the doctor orders shows no abnormalities, and you're told you have no problems and you pass with flying colors, see you next year, please know that this is as far from an anti-aging wellness exam as possible. So let me dive right in and give you my top 10 things or markers that I focus on in a wellness exam for someone that is seeking anti-aging care. Number one, and first of all, to understand the level of damage that aging has done, your doctor has to spend time interviewing you and asking many questions about how you feel. This is called review of systems, or in short, ROS. When you have a wellness exam, this is your first tip on whether or not you're having a good, valuable wellness exam. How much time your provider spends with you. And let me take a little side note here, just a little bit of something. When I say provider, I mention provider because this is now the word the medical system likes to call us, the mid-level and the doctors together. Just simply bunches up the doctors, the mid-levels. This is the trend to make you believe sometimes that there is no difference. You could get just as good of an exam from mid-level as well as you can from an MD. Unfortunately, in many cases, that's probably right, because there's so many PAs and family nurse practitioners with experience who have been trained by their supervising physician in the art of wellness, in the art of anti-aging, and recognize the value of spending time to get to understand the patient. So these mid-level providers would likely do a much better job with this exam than a doctor who will spend maximum 10 to 15 minutes and probably ignore all the warning signs and symptoms of aging and simply just order some basic testing of whatever your insurance would cover without explaining there are other comprehensive tests that you can have that could shed valuable light or valuable information on how well you're aging or not. Closing this little side note, when I say providers, that's what I mean. I want to stay focused because I want to shorten my episodes and cram them just full of information rather than going off on a tangent. The most important, the number one valuable tip of a well-performed anti-aging wellness exam is the time, the gift of time spent assessing the signs and symptoms of your current state of health. And that needs to be a pretty thorough interview, going through every possible system of the body. I talked about this in a previous episode. Go back listening to my wellness episodes. Somewhere in their 30s, I think I went and reviewed the ROS in detail. Number two, the next most valuable marker or tip, it doesn't mean it's second on the list where it could go. It's just number two on my list. It could be done at the end after all the other stuff I just mentioned. However, this is something that would be usually done once the interview of all the signs and symptoms and the physical exam part of the wellness check is done. And this would be ordering a comprehensive battery of blood tests, testing possibly urine as well as other tests deemed necessary by the review of symptoms. So let me talk anti-aging testing. Would there be a minimum requirement if you have zero signs and symptoms and you look and feel great? Yes. Let me talk about that. You're looking for a fasting comprehensive metabolic panel, a fasting insulin and fasting hemoglobin A1C, that's the glycosylated hemoglobin, a fasting lipid panel, a high sensitive CRP, that's an inflammation marker, and a SED rate, that's ESR. Those are very valuable inflammation markers. A complete blood count, a complete thyroid panel, ideally with antibodies, basic vitamin level testing like B12, vitamin D, and iron. Now, a more in-depth anti-aging evaluation might include what Quest calls some cardiac IQ testing panels. There's a cardiac IQ for insulin resistance. There's a cardiac IQ for lipid particle size. There's a cardiac IQ lipid panel with inflammation. There's quite a few additional tests that are very valuable from an anti-aging standpoint. So, number one, signs and symptoms. Number two, blood testing. Number three, an assessment of your cardiovascular fitness, which can be done simply and non-invasively in the doctor's office with a very simple assessment of basic measurements and some simple questions. So let me review what those might be. Some basic measurements would be your blood pressure, your resting heart rate, maybe an EKG in the doctor's office. There might be some interview questions that might be needed, or some questions that need to be asked. What is your recovery heart rate post-exercise? How fast do you get back to baseline? How often do you exercise within the optimal exercise heart rate for your age? How often do you exercise where your heart rate gets to 80% or more of optimal heart rate? Obviously, if the answer is, well, I don't exercise, or I don't monitor my heart rate during exercise, this is already telling. There might be some disinterest on your part in achieving an optimal cardiovascular fitness after 50, and you probably don't have this fitness as well. On the other hand, you might be exercising and tracking your heart rate, but have other issues like your blood pressure is high. Maybe you're on medication, you're not able to get your heart rate in the optimum zone for your age because of blood pressure medication. Or you might have a very high resting heart rate indicating anxiety, stress, and overfunctioning adrenergic system. Now, when you reach 50 and beyond, an in-depth cardiovascular assessment might be in order. Why am I mentioning cardiovascular assessments in such a high position on my top list of 10? Because many do not understand the value or the role of the heart. Yes, everybody knows the heart is the pump without which we cannot live. But most people ignore it completely and expect that they will have some warning signs and symptoms before something goes wrong with their heart. That is a very false belief. If that's what you believe and if that's what you expect, that there would be signs and symptoms when you have a heart problem, if you get anything from this podcast episode, then this should be it. Heart disease has no signs and symptoms and gives you no warning. That is why preventive care and periodic assessments of your heart function, of your cardiovascular fitness and your cardiovascular health are essential. So what would that look like? Well, if you didn't know, let me tell you that the top killer of men and women after 50 is heart disease, not cervical cancer. So don't worry about your pap smear when you pass 50. Don't ignore it, but don't worry about it as much as you should worry about your heart if you're a woman over 50. To keep it simple, at the core of heart disease, there is atherosclerosis. So Having tests performed that look for plaque, like a calcium score that looks at total plaque in your heart arteries, or a simple non-invasive test like a carotid Doppler flow assessment, where an ultrasound measures the blood flow over your carotid arteries to assess whether or not there's an obstructive flow due to plaque. These two things are a start. Now, the gold standard test for plaque is angiography. That's a small tube placed in a major blood vessel, and then contrast material is injected and followed by a radiologist on the screen, allowing a mapping of all the blood flow within your heart. That's actually invasive to some extent, so a Doppler ultrasound test is easier and is non-invasive. So ask your doctor for one. But remember that the CT angiography can detect and evaluate soft plaque, so it's very valuable. Atherosclerosis and soft plaque are dangerous. Most of the times a heart attack or a stroke happens, it's because a small piece of the plaque breaks and travels downstream to block the blood flow for an important part of the heart, creating a shutoff, or for an important part of the brain, leading to a shutdown of that part of the brain. If the part of the brain or the heart are losing their oxygenation, they will shut down normal function. So we end up with a heart attack or a stroke. If you recognize signs and symptoms and get medical care quickly, the loss of blood flow can be reversed. There are medications that can dissolve that small fragment, open up the blood vessel that was clogged, allowing for what we call reperfusion. And hopefully, fingers crossed, we can reverse the damage. So the heart recovers and the brain recovers. However, we don't want to get there. We want to find out beforehand if we have plaque. So consider these two tests. Carotid Doppler ultrasound is just a simple ultrasound of your neck, and a calcium score. So top 3 markers of a well-performed wellness exam is a thorough review of signs and symptoms, a comprehensive battery of blood tests, and a cardiovascular fitness evaluation. So what is number 4? Well, number 4 is your body mass composition and abdominal circumference. Basic measurements like height and weight are very telling, but they're usually not enough. So focusing on healthy muscle mass and central adipose tissue or abdominal visceral fat, those are key important markers of your wellness and of your metabolic health. I have talked about metabolic health in my previous episodes that reviewed wellness, so go back and listen to those. Even the ones that refer to the younger decades, they apply to you. Belly fat equals inflammatory fat, predicts chronic metabolic disease. We want to assess it, evaluate it, get rid of it. Number 5 is cancer screening. You're wondering, why cancer screening? Why is this such an important marker? It's important, and it needs to be a crucial part of a wellness anti-aging exam because cancer is a top cause of morbidity, mortality, and healthcare expenses after the age of 50. The statistics are highly impressive, and the top killer cancers are actually digestive cancers like colon cancer and respiratory cancers like lung cancer. Most women are afraid of breast cancer or uterine cancer, and most men are afraid of prostate cancer, as they should be, because as a woman or a man gets older past the age of 60, their risk goes up significantly with age because of many factors for these 2 specific cancers. But what is interesting and what I want you to stop and think for a second is why digestive cancer is the most frequent, followed by lung cancer. Most likely the answer is because we put a lot of crappy stuff in our mouth and we ask our body to digest it for the simple, short-lived pleasure of what it feels like to eat or drink that specific crap. Maybe lung cancer is a number 2 because there's so much in our environment and atmosphere that is toxic waste, byproduct, and man-made. And I'm talking mostly about industrial waste or environmental disasters, which we just had some major fires in Southern California in the Los Angeles County that probably spread a lot of stuff in the atmosphere. And this is much more important than the poor cows farting and causing emissions. Now, making America healthy again is a lofty ideal. And I am absolutely sure it's not going to be about banning vaccines, like some people worry about needlessly, but instead, it will be, and it should be, about cleaning up what we eat and cleaning up what we breathe. Hopefully, at some point, it will be also about cleaning up what we put in our bodies, which includes skincare products, soaps, shampoos, fragrances, and last but not least, vitamins and supplements. The cancer screening topic is deserving of a few words. And I want to take a little bit more time and go into it in detail. So I'll come back next episode with the remaining 5 valuable tips about wellness exam in your 50s and beyond from an anti-aging standpoint. And that would include taking over the cancer screening, talking about bone density and muscle mass consideration, sexual wellness, pelvic, breast, prostate checks, mental health evaluation, hormonal wellness, and vision and hearing testing. So please join me next week as I continue with my anti-aging wellness exam, top 10 valuable markers. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.